Kia ora, my name is Hemara Tylden and I'm the Māori Bowel Screening Program Coordinator. The National Bowel Screening Program is to help detect bowel cancer early. It is run for people aged 60 to 74 years old, for men and women, and the idea is that you're doing this screening every 2 years. When you turn 60, you'll get an invitation letter in your mailbox saying you're now eligible to participate in the bowel screening program. A couple of weeks later, you'll be sent the actual test kit, and in that test kit, it will have the test and it'll also have a consent form and a free postage letter. So you send it all back in the mail as well. Your result letter also comes back to you in the mail. You're taking a sample from when you go to the toilet for your number 2, and this little test, it's detecting blood that might be present. Blood can be an indication of bowel cancer or some other problems that you might have going on. Common symptoms of bowel cancer: bleeding, so if you can see blood when you go to the toilet, if you have severe abdominal pain several weeks or it comes in on and off, that's also something to look out for. If you can find a lump anywhere like in the lower region of your body, that's also something to discuss with your GP. If you're either constipated lasting several weeks or you've got diarrhea that lasts several weeks as well. But if you're younger than 60 and you're experiencing these symptoms, don't wait to age into the program. And if you're someone who has a strong family history of bowel cancer as well, if you're presenting these symptoms, it's actually best to see your GP and not wait to participate in the program, because screening programs are for people who are asymptomatic, so you're not meant to be showing any symptoms. Our Māori Pacific whānau, we have a higher rate of bowel cancer and at an earlier age as well. It's a combination of things: lifestyle, getting enough exercise, including enough fibre in your diet. It can also be genetic as well, and definitely people who have a strong family history of bowel cancer. So you don't have to be old. Looking at those things is really important if you're at high risk. My work is to promote it out in the community, out for our Māori and Pacific communities as well. Talk about bowel screening and why it's important, what to do, help educate our whānau on the National Bowel Screening Program and bowel cancer. When we actually explain to them what it is and why we do it, why you should encourage your friends and other whānau to do it, they start to understand, and we can say that we've helped a lot of people do their tests and it's actually saved a few of their lives as well. Know that we've caught it at a much earlier stage, and there's a lot of value in that. The whole idea that you're trying to catch bowel cancer early, so regular screening really decreases your chances of being diagnosed with it at stage 4 or stage 3. We want you to be completing these tests regularly, that every 2 years. So if something does come up, we catch it at a very early stage. Encouraging your own parents, grandparents, aunties and uncles to do their tests, to give them that peace of mind. And it is easy, and always inquire with the free 0800 number if you haven't received your test and you're waiting for it, or you need help on how to actually do the test. I enjoy going into different communities to do really good mahi. It is rewarding, especially when you know that people are learning from you and they're taking in what you're saying about not just bowel screening but just screening in general. We're able to provide people access to that knowledge about something like bowel screening. Taking that to people is really rewarding.